Good day everyone. So our topic for today is barriers to physical education and solution. So in barriers, many technological advances and conveniences that have made our lives easier and less active many personnel. So variables including psychological, behavioral, and psychological factors may affect our plans to become more physically active and understanding common barriers to physical activity. So, and creating strategies to overcome may help make physical activity part of daily life. So, people experience a variety of personal and environmental barriers to engaging in regular physical activities. So in personal barriers is with technological advances and conveniences, people's lives have in many ways become increasingly easier. So as well as less active. In addition, people have many personal reason or explanation for being inactive. The most common reason adults don't adopt more physically active lifestyle are cite as so first insufficient time to exercise. Next, inconveniences of exercise. Next, lack of self-motivation. Next, non-enjoyment of exercise, boredom with exercise, lack of convenience, lack of confidence in their ability to be physically active or low self-efficiency. So in environmental barriers, the environment in which we live has a great influence in our level of physical activity. Many factors in our environment affect us. So obvious factors include the accessibility of walking paths, cycling trails, and recreation facilities. Factors such as traffic, availability of public transportation, crime, and pollution may also have an effect. And other environmental factors include our social environment, such as support from family and friends and community spirit. In identifying barriers to physical activity, the barriers to being physical active quiz was created by the Centers for Disease Control and Prevention to help identify barriers to physical activity and steer clinician and participants awareness and target strategy to improve compliance. So, it a 21 item measure assessing the following barriers to physical activity. 1. Lack of time. 2. Social influence. 3. Lack of energy. 4. Lack of willpower. 5. Fear of injury. 6. Lack of skill. And 7. Lack of sources. Example, recreational facilities, exercise equipment. So, each domain contains 3 items with with a total score range of of, of 0 to 63 respondents. In overcoming barriers, as a healthcare professionals, we can help people identify barriers to exercise and make suggestions for how they can overcome these barriers. The Centers for Disease Control and Prevention make suggests for overcoming physical activity barriers. So first is lack of time, identify available time slot. So in Monitor your daily activities for 1 week. Identify at least 3 to 30 minute time slots you could use for physical activity. So in social influence, explain your interest in physical activity, friends and family. Ask them to support your efforts. In lack of energy, schedule physical activity for times in the day or a week when you feel energy or energetic. So, next is lack of motivation. So, plan ahead, make physical activity a regular part of your daily or weekly schedule and write it in your calendar. And next is fear of injury. So, learn how to warm up and cool down to prevent injury. Next is lack of skills. So, select activities requiring no new skills such as walking, climbing, stairs, or jogging. Next is lack of resources. Select, select activities that require minimal facilities or equipment such as walking, jogging, jumping rope, or calisthenics. And next is weather conditions. So, in weather conditions, develop a set of regular activities that are allows that are always available regardless uh, of weather, which is indoor cycling, aerobic dance, indoor swimming, calisthenics, stair climbing, rope skipping, mall walking, dancing, gymnasium games, and etc. So next is travel. So in the travel is put a jump rope in your suitcase and jump rope. And family obligations, trade babysitting, time with a friend, neighbor, or family member who always has a small children. So that's all. Thank you and God bless.